Kids gain confidence through doing vision therapy because they're not reversing letters and words anymore. They know their rights and their lefts. They've improved in their reading. They feel really good about themselves. So I've just seen it to be life-changing, not only for the child, but for the families that support that child. So vision therapy is an individualized treatment program prescribed by a doctor of optometry to improve conditions like crossed eyes or lazy eye. Vision therapy helps individuals learn, relearn, and reinforce specific visual skills such as eye movement accuracy, focusing, control, and coordination of the eyes working together. H-L. And you're gonna switch hands each time.
Oh, I gotta be on beat.
Yep, you gotta be on the beat, so you have to listen, and you gotta switch hands.
R, O, M, F, N, C, not Y, A, L.
So some of the symptoms that a parent or a teacher can look for in a child is double vision while reading, blurry vision while reading, headaches at school, letters and words jumping around on the page while they're reading. There can be letter and word reversals and difficulty attending for any period of time. How many beads do you see?
1.
Okay, and when you're looking at that bead, how many strings do you notice coming out of the bead on either end?
2.
That's exactly right. How many beads do you see?
1, and still an X.
Okay, good. How many beads do you see?
1.
Okay. How many beads?
1.
Good. How many beads?
1 bead.
So there are a lot of things that we work on in the session depending on what the diagnosis is by the optometrist. But we start with primitive reflexes, primitive reflex integration therapy. We also work with gross motor, then fine motor, and then oculomotor. So oculomotor is the movement of the eyes, whether it's converging, diverging, our quick eye movements, as well as our pursuits. Basically, they're looking for the letter that fits the symbol, which are numbers. So they may, if it's 5 and 7, they're gonna count down 1, 2, 3, 4, 5, and then 1, 2, 3, 4, 5, 6, 7, and they write the letter P. But they're sitting back here, they're not using their head to count, they're not using their finger to count, they're only using their eyes. So it requires very accurate ocular motor control. So right here, they're looking for that letter. So it says 5 and 10. So
Okay.
see if you can figure out which letter goes there from how I showed you. Vertically first and then
So that's another.
horizontally.
Right?
So you shouldn't regress after you've completed vision therapy, but a patient does want to continue to focus on using their eyes properly the way they've learned so that they have good binocular vision. You also, as a child, want to be moving, playing sports, climbing trees, riding a bike. Movement is critical for good vision. Put these on.
This is like when I go to a 3D movie.
Kind of, but it's not 3D.
Oh.
So, can you read the top row of letters and numbers?
PE7DXH.
Okay, so you are not suppressing either eye. So you've got good binocular vision. Someone that's suppressing, let's say, with either eye, they're not going to see all of those letters. So if they're suppressing their left eye, they're not going to see the white. If they're suppressing in their right eye, they're not going to see.
Oh, I see, because the red filters out the red.
That's exactly right. So it depends on how severe the problem is. For more minor problems like eye movement accuracy, convergence insufficiency, maybe 10 to 15 sessions. If you've got strabismus or amblyopia, so a crossed eye or a lazy eye, it's going to be longer. It depends on how your brain works for how long vision therapy will take for you, as well as how much work you put in at home. Doing work at home is really critical to vision therapy. It's the repetition that you need. We also do what's called alphabet saccades. And what this is an activity where they're working on their accommodation. So you want to look at something like up close.
So what's
so
happening
that's
here?
plus. So what do you see when you look? Is it bigger or smaller? when you look through the plus lenses.
Oh yeah, a little bit bigger. Yeah, it looks
Okay.
closer. Yeah.
I highly recommend vision therapy. I've seen that it is life-changing. Kids go up several reading and math levels after or during vision therapy even. Kids gain confidence through doing vision therapy because they're not reversing letters and words anymore. They know their rights and their lefts. They've improved in their reading. They feel really good about themselves. So I've just seen it to be life-changing, not only for the child, but for the families that support that child. You can contact Eye Expressions, phone in, and Janice or one of the girls will set them up with an appointment for an assessment.